Hi, you guys. This is Chapter 10, Lecture 1. Chapter 10 is titled Calculation of Medications for Special Populations Based on Body Weight and Patient Age. As usual, my disclaimer is that you should have already read Chapter 10, should have reviewed the PowerPoint, and read the lecture notes that's provided to you within Blackboard. So what I'm going to do now is I'm just going to kind of give you guys an overview of the information that you've read in Chapter 10, within your book and your notes and your lecture notes and so on. So as you can see here, I've typed up a couple of things that I just want you guys to keep in mind. But one of the things I want you guys to know is that majority of all medications, unless it is commercially available in a pediatric form, is basically made for an average adult, okay? Which means that if a medication or if an adult is very sickly and doesn't have normal organ functions and so on, they will have to get their dosage recalculated based off of their issues or symptoms that they're having with their illness. So with that in mind, you have to keep in mind that special populations include children. As you can see here, I have it written down for you guys, is that special populations include children, all right, adults of a non-average size. So, for instance, little people, all right, that's a great example. They're considered within that special populations group. Any patient whom is suffering from a serious illness such as AIDS or cancer, or even a patient that's has bone marrow issues, whatever the case may be, we know that that's a serious illness and that their organs aren't functioning correctly. So they're going to be considered special populations. So overall, as I've been saying, any patient whom may not have normal organ functions are going to be considered within our special population groups, and we're going to have to recalculate their dose using special formulas. Now, when it comes to children, you guys, I want you guys to keep in mind that children are categorized in 5 areas. I have 4 here, but it should be 5. They're categorized in 5 areas. The first area is considered your neonates. So basically that's considered what? Newborns. Your neonates are your newborns. All right. That's from birth to 1 month. Your infants are from 1 month to a year. Early childhood is from 1 year to 5 years of age. Late childhood is from 6 years to 12 years of age. And adolescence is from 13 years to 17 years of age. Normally, most pediatric doctors normally stop seeing a female child when she begins her menstrual cycle. And it's not that they won't continue to review that child's growth or so on, but that's at that point that this young lady will then have an additional doctor added on to her pediatric care, which is her gynecologist. As for males continue to go to their pediatric doctors up until they're about 17 years of age. Some doctors go up to 20 years of age. Just all depends on the doctor and, of course, the comfortability of the patient themselves. Now, with that in mind, when it comes to these special populations groups, whether, they're children, adults of a non-average size, or just an ill patient, we have to recalculate their dose, all right, based on several different formulas, several different mathematical processes or procedures that we use. And those procedures are, one of those is the body weight method. With the body weight method, very interesting, the body weight method is basically where you're calculating a dose. You're calculating a dose using the patient's weight, and you're multiplying it by the weight strength of the medication. And I'll show you guys an example of that. But that's one example of the special formulas. With a body weight method, you can use this method for just about any patient, whether on children, adults, your geriatric patients, your elderly patients. You can use this on just about any patient. Another thing to keep in mind is that the body weight method, as you guys will see within other chapters, the body weight method doesn't necessarily have to be used for patients that fall in special populations. Some manufacturers use the body weight method for you guys within the pharmacy department to determine what's the best dose for that patient. I'll give you guys an example of a body weight method. Turn to page 347. 347. This is example 10-1. All right. And if I read this, it says that a child has been diagnosed with epilepsy, weighs 53 pounds. The physician orders Dilantin 30 milligrams to be given at 2.5 milligram per kilogram per dose. What dose of the medication should be given to the child? Well, first things first, with these problems, you always pull out the information that you need. So first things first, you need to identify the patient's information. Well, the patient's information is 53 pounds. The next thing you need to identify is you need to identify the order. So, of course, I'm going to put RX because that's what the order is. And the order is what? Dilantin 30 milligrams given at 2.5 milligram per kilogram per dose. All right. And then your next thing you need to identify is that you need to identify what you have in stock. Well, what I have in stock is what? If I read that label, it says Dilantin 30 milligram capsules. I'm going to put caps here. All right. So that's the very first thing you need to do with this problem is that you pull out the information that you need. All right. I pulled out that the patient is what? They weigh 53 pounds. I pulled out the information as far as the order. This order includes what we call a dose regimen. The dose regimen is that 2.5 milligram per kilogram per dose. I have that information. And then I also have the information in regards to what's in stock. All right. Well, the question is, what dose of the medication should be given to the child? So, even though the doctor has ordered 2.5 milligrams per kilogram, that doesn't tell you the true dose. That could be 180 milligrams or 230 milligrams. We don't know. We have to determine that. So how do we determine that? Well, I'm going to get a new document here so I can show you. Well, the first things first is that you guys need to make sure when it comes to the patient's info, which is what, 53 pounds, and the dose regimen I told you guys was what, 2.5 milligram per kilogram per dose. What this question is asking is that they want you to calculate the dose order. Well, in order to calculate the dose order, you are going to use the body weight method, where you ask yourself, does the patient's info, this 53 pounds, does it match the regimen? And what I mean by that is that the regimen tells you suggested dose, suggested weight, and of course it tells you suggested frequency. Well, the question is, does this 53 pounds match the regimen of the body weight? It doesn't. So my next step is to change 53 pounds to kilograms by doing what? Dividing by 2.2 pounds. So a patient that is 53 pounds is 24.09 kilograms. Remember, body weight is always to the 10th place, so you need to round that off to 24.1 kilograms. I don't care what your book has it. I want the body weight of a patient. Body weight always rounded to 10th placement. Okay? So now that we have determined the patient's weight, we've changed the patient's weight to match the regimen. So now the patient's weight is what? 24.1 kilograms. Now that it matches the regimen, you can now just solve the body weight method by just multiplying it out, which is 24.1 kilograms times that dose regimen of 2.5 milligram per kilogram. As you can see, kilograms cross out. 24.1 times 2.5 gives you 60.25 milligrams. So in detail, the doctor has ordered, this is the dose order, 60.25 milligrams is what the patient should be receiving for this medication. All right. We're going to do another practice problem, but I'm going to go ahead and close this lecture 1 out since I'm running out of time on my screencast. But of course, I'll pick the lecture back up on the next video. Again, if you have any questions, feel free to contact me via email and phone call, whatever the case may be, so that we can make sure that you guys fully understand this information.